You met as a committee last week and you rejected the contract for England. So why is it a bad deal for general practice in your view?
In a nutshell, this practice is imposing unrealistic and unsafe changes to the practice contract. You look at it and you think, hang on a second, is this a GP practice contract, or is this just some sort of ruse to protect emergency departments and 111 and try and mitigate corridor care and try and manage elective waiting lists and protect hospitals as much as we can? Or is this what we've been told around the shift from hospital to community and the shift from sickness to prevention and the shift from analogue to digital? What the government is saying and what they're doing, it feels like it's two different things. And it's unsurprising that a lot of GPs have said to me it feels very gaslighty, and I feel that too, because there's really warm words coming out of government to me and to my BMA colleagues around getting round the table for a new contract. And yet you're like, well, when? Because it's almost a year ago that we got that written promise from Wes Streeting, and 12 months on, we really are no further forward. And time's running out. And in that time, how many hundreds of practices are now gone? How many experienced partners have now walked away? And yeah, the number of unemployed GPs is a massive issue. And you might look at that as being a less bad part of this contract, but it all has some really existential problems attached to it. And I'm not being hyperbolic here. I genuinely mean it. If you take the advice and guidance contractualisation, and if you put that alongside the medium-term planning frameworks, clear articulation of what they want to do around advice and refer, that is an absolute recipe for total destruction of general practice. If you remove the right to refer, you uncap and enforce contractually all urgent care and all non-urgent care, we can't bend the laws of physics. We are not magicians. There's no more rooms, there's no more appointments, practices are incredibly stressed. They're going to hit absolute overwhelm, and you can't help but feel this is, as it ever was, this David and Goliath between general practice and these huge multi-billion-pound acutes that are seen as too big to fail.